Okay, we're back with Grazel, and today I'm going to ask you a question that actually it feels very emotionally charged, but someone's been asking, why do I cry so much after therapy? Do you have any insights on why that might be?
I mean, I think the main answer to that, and it can be different for everyone, of course, but in general, when there's pain in our hearts and there's sadness and there's hurt, um, it's not it's natural for us to cry,
Hmm.
right? So I guess the question of why do I cry so much after therapy? It's because there's a lot of things that we uncover in therapy that you usually don't pay attention to.
Mhm.
So once we bring the emotions alive in the room and negative experiences or traumatic experiences you've had, you're actually pulling from your hippocampus the memories that's stored in there for so long that you haven't really processed. So it's going to be sensitive. And it makes so much sense that you're going to cry a lot. Some people, though, because it's so overwhelming, some people don't cry. But there are people that cry a lot. Yes. And that's totally okay.
Yeah, I feel like I don't know if it's in particular a Western culture thing, but we have this idea that crying is wrong, which is an interesting idea because if you're crying, it's just an expression of emotion, and you can't say an emotion is wrong. It's just something that happens,
Exactly.
right? Um, so why is it that you're in the room in therapy, you're bringing up a sensitive topic, it's triggering memories from the hippocampus, really intense feelings. Why is it that most people can't just park those feelings in the therapy room and walk away? And should they be able to, or is it okay for them to linger?
I think there's benefits and disadvantages to both.
Mm,
Okay, there's advantages to lingering in the emotions, especially if the person haven't really learned how to trust their emotions. And there are some people that are very in their emotions and they need a way to park their emotions at times. And that's healthy too. So you have a balance.
mm,
So there's advantages in parking it and there's advantages in lingering in it.
yeah,
And there's a disadvantage in not feeling it at all.
yeah,
Yeah.
yeah. I guess yeah, it's an interesting thing when I've been in therapy. Sometimes therapists have told me just make sure you don't have a big work meeting after the session, or you give yourself time to kind of process afterwards. You don't do anything big. Is that something that you would recommend, just to give yourself that space?
Absolutely. I think that's so healthy. I mean, I do that for myself as a therapist. I think we have to really practice giving space for ourselves in moments when we are going through something, to just give yourself a little bit of a buffer time, right, after therapy, so that you don't have to completely dissociate from your feelings because you have to do something. That's too extreme. Yeah.
Yeah. Do you think it could actually be damaging if you're feeling something quite intense and you force yourself to turn it off because you need to go for this big work meeting or you've got a presentation or whatever? Can that be damaging, or is that okay?
I think it's okay so long as it's not a pattern.
Okay.
When it becomes a pattern, then that's when we actually need to look at how the pattern is affecting the person. But if it's something you actually need to do, like for folks that work in the front lines, like medical doctors in the ER or firefighters, and if they're going through something, including therapists too, right? If they're going through something and they have to attend to a crisis, they need to be able to park what's going on for them to be present in their work,
Yeah.
as long as they're able to come back to it,
Mm.
right? But if it's becoming a pattern where they're completely avoiding and they don't know how to get back to processing their own feelings and giving grace for themselves, then absolutely we want to help them get back to that.
Yeah, because I guess at that point you're trying to avoid feeling the thing that actually you need to feel in order to heal. Um,
Yes.
so
Yes.
obviously we know tears can be a sign of that kind of inner emotional work, that inner healing, and they can just be a sign of emotional release from the emotions finally shifting from your hippocampus or wherever else they're stored in your body and just finally coming out. Is there a kind of difference between those two scenarios? How can you tell the difference between just that kind of release and actually, no, this is actually healing something in me and I'm not going to have the same issue moving forwards?
I think for the therapist, they need to be able to teach the client or their patient to know their window of tolerance, right? You, if there's a client that's coming in to therapy and it's new in therapy and it's new in feeling their emotions, then you want to go slow with the client.
Mm-hmm.
It's so important to create safety. And I think this gets asked a lot, right? In a lot of people are asking, do we dig deeper right away in our first initial sessions?
Mm-hmm.
No, because there's a clinical importance to making sure that you're safe when you start to feel your emotions. So we go slow in the beginning, and then we try to provide some regulation skills, emotional skills. And then the more you increase your tolerance and feeling your emotions, then the more we go deeper.
Mm-hmm. Yeah, that makes total sense. So on the client side, if they've had a particularly emotionally charged session, they're kind of really wound up. What sort of things can they do for themselves to help take care of themselves beyond just giving space to feel?
In session and after session, and when they're on their own.
After session when they're on their own.
Um, Usually, I would give them something to do, right? Like knowing how to ground themselves. And perhaps if they like meditation, they will have to engage in that.
Mhm.
If they want to work with moving their bodies, then I will have them kind of go for a walk or do an exercise. If they enjoy video games, then I will have them distract and enjoy something they love to do so it doesn't feel so overwhelming and their body and their nervous system can rest for a little bit. It just depends on what works for them. So usually I would ask them, what have you found has worked for you? And for patients that don't know that yet, then I'll give them something to take home.
Yeah, yeah, because it's really important to have something to go home with, to do, to process what you've been feeling, because otherwise you can kind of feel a little left on your own. And it's great to hear that you don't leave your clients like that. Um,
Yeah.
so obviously therapy is it's a multi-session thing. You don't do everything in one session. And if you've dealt with something really emotionally charged in that one session, you know you're probably going to be revisiting it in the next one. So, is there anything that the client could do to kind of prepare for that or to try and get themselves in the right frame of mind to revisit that thing that was really difficult for them?
Yes, for me, I prepare my couples in a way that, before when I'm seeing a lot of emotions come up in the room and it's becoming overwhelming, I do emotional regulation skills right away in the room so that when they leave, they're not feeling so overwhelmed by their own emotions. I get them ready for that before they leave if I have time. And then when they come back,
Mm-hmm.
before I go in, I slowly bring them in. And then we slowly talk about how great they did previous session in regulating their emotions so they can feel less afraid about going back to that really sensitive emotion,
Mm-hmm.
right?
Yeah,
So,
because especially with weekly sessions, it could still feel quite raw, and you kind of don't want to pull at an open nerve. But if someone's managed to do that work in between the sessions, I guess it can lessen the impact and it feels safer to revisit it. Would you agree?
yeah, if oh, you're asking if in between they can do something before they come in. In between, yeah, they can usually just, employ kind of and apply and implement all the things that they already know to take care of themselves. Because again, the first thing to processing deeper emotions is to know that you're able to sit with them. So you
Mm.
need to be able to know what regulation skills you have so that you could practice it in between sessions. So you will just go back and keep practicing and implementing the same tools that you've already used. That helps.
Yeah. Okay. Um, and just one final question that's just occurred to me. Is crying ever a something to be avoided? Like not necessarily because you've got a meeting or whatever, but just in general, should you ever avoid expressing that?
Crying.
Yeah.
Yes. When crying is used to soothe your own anxiety so that you're not engaging into conflict, then maybe you have to realize to kind of park that for a little bit so that you can have a harmonious conversation with the other person.
Hmm.
Because there's moments when the crying takes a lot of space from processing the actual relational issue, right?
So
And the therapist, yeah.
I was just going to say, so as an example, would that be um, a guy and a girl? The guy's trying to talk about something serious. The girl gets very, very upset. She starts crying. Then the guy goes to comfort the girl, and they never actually cycle back to the thing that they're actually talking about. Is that where it becomes an issue? Is that what you're saying?
If Yeah, if the crying is s- staying there for quite a long time and they're not able to get back to the issue. However, eh, I want to be careful when I say that because with neurodiverse couples, it's very different, right? Like for someone who's neurodivergent, they're usually more sensitive to feeling emotions.
Mm.
So, meaning they have a different level of intensity when they feel emotions, and there's nothing wrong with that. But they need to be able to understand the science behind their neurodivergence and what happens when they're emotionally dysregulated, that they can stay longer in a space where they're crying a lot.
Mm.
So it doesn't necessarily mean that they are not going to go back to the relational issue that needs to be attended to. It may just take a little bit longer for them to regulate.
Mm.
So they need more help and guidance in that way. There's also an issue about the partner comforting the person that's crying right away because, I mean, what moves you to comfort your partner that's crying right away anyway? If that's exactly what you do all the time and your partner is still crying, then probably it's not helping,
That's a point.
right? I mean, comfort is generally helpful, but if comforting the partner that's crying all the time is a repetition of a pattern,
Mm.
then it's part of your negative cycle.
Yeah,
It's not working.
yeah, that's really
Does
interesting.
that make sense?
Yeah, no, that makes total sense.
Yeah.
I was expecting you to say no. There's never a situation where crying is not okay. So that's super interesting. How if the crying itself becomes an issue that prevents the relationship or prevents the addressing of the issues in the relationship, then yeah, that is a problem, and maybe the person needs to keep a lid on it a bit just to actually deal with the stuff. Um, yeah, that's really interesting.
Yeah. Yeah. And the partner that's always comforting the person that's crying
Yeah.
also needs to understand what makes you go to comfort right away. What's going on for you when you see your partner crying when you're talking about something.
Mm.
I'm sure that it's really hard for them too, but they have no choice but to feel empathy and comfort. That makes so much sense. But they both have to do the work in putting a lid on.
Yeah,
Yeah.
that's great. Yeah, really interesting end to that conversation. Thank you so much. Have a great rest of your
You're
day.
welcome. You too.